The latest surveys of the Ministry of Health indicate that 9.5% of the population is affected by genetic, metabolic, and infectious diseases, underscoring the urgency of proactive screening. Hence, to prioritize preventive health care and reduce the burden of these conditions on individuals, families, and the healthcare system, the Ministry of Health announced launching the expansion of newborn screening and the enhancement of premarital medical examination.
These two initiatives, actually, it's very important programs. It goes with the Oman Vision 2040 to increase the quality of life of the Omani population. The significant importance is come from the targeting the preventive programs, which is early screening for congenital diseases, for metabolic disorders, and also for screening of the premarital, screening for hematological disorder like sickle cell disease and thalassemia.
The expanded newborn screening program will allow for the detection of multiple conditions from a small blood sample taken from newborns within the first few days of life. Initially, the program will be rolled out in Muscat with gradual nationwide expansion to assess challenges and enhance readiness.
Newborn screening program, it's a public health initiative in which all children at birth will be screened. And basically what we will do is that we'll take a small sample from the foot of the baby. And so that will be assessed for various metabolic conditions, which are genetic conditions, which are treatable. And so the reason we're doing that is that because we want to detect those babies before they have symptoms. So when we treat them, they would have the best outcome.
The premarital medical examination initiative will be implemented in 3 phases: an optional screening phase in 2024-2025, an expansion to 10th grade students in 2025-2026, and mandatory screening by 2026, which will become a legal prerequisite for marriage.
The Ministry of Health working now on enhancing the programs of premarital screening, which will include expansion of the number and type of tests, which will to include screening for infectious disease in addition to screening of hereditary blood disorders, also screening if there is any other hereditary disorders in the family, and to provide appropriate counseling.
To raise awareness, the Ministry of Health launched a national media campaign under the theme Start Right, running throughout 2025 in preparation for the mandatory screening. This initiative is not merely an enhancement of healthcare, it's an investment in the well-being of children, the stability of families, and the future of an entire nation. Reporting from Muscat, this is Saleh bin Khalfan al-Rahbi.